Hi, good morning, everyone. This is Dr. Payal Sharma Kamath. I'm a psychiatrist and a counselor. I practice in Borivali, Bombay. So today I'm going to discuss about depression. What are the kinds of depression that we know? What is the causes of depression? What are different treatments modality which is available? Just a quick and a brief review, not a long-term lecture and a boring conversation. See, to understand depression, there are many such mental problems that a person can have. सो जो हमारा ब्रेन है वो एक जिस प्रकार से हार्ट होता है, लंग्स होता है, हमारी बॉडी में बहुत सारे डिफरेंट ऑर्गन्स होते हैं, उसी तरह से ब्रेन हमारा बहुत इम्पोर्टेंट ऑर्गन है। ये हमारी जस्ट मूवमेंट्स को ही नहीं डिफ़ाइन करता है, किस तरह से बॉडी काम करेगी उसको ही नहीं डिफ़ाइन करता है, साथ ही साथ हमारी फीलिंग्स, हमारे थॉट्स, हमारे बिहेवियर, हमारे जजमेंट्स, सो मच ऑफ ब्रेन हैज़ टू डू ऑल द टाइम। तो ब्रेन में बहुत सारे तरह के केमिकल्स होते हैं टू अंडरस्टैंड. There are many chemicals which are just not in the patients of depression, which is present in all of our brain. आपके, मेरे, हम सब के जो लोग the people you interact, you see every day, you work with, you eat with, all of them have those chemicals in the brain. सो कभी कभी वो केमिकल्स का इम्बैलेंस क्रिएट हो सकता है. तो क्यों ये इम्बैलेंस क्रिएट होता है, क्या कारण है ये इम्बैलेंस क्रिएट होने का? जिस तरह से डायबिटीज़, ब्लड प्रेशर, थायराइड रिलेटेड कॉमन बीमारियां हम लोग सुनते हैं, वो भी किसी न किसी केमिकल्स, हार्मोन्स से रेगुलेटेड होती है. तो जिस तरह से उन बीमारियों में केमिकल्स का प्रॉब्लम होता है, वैसे ही सिमिलरली डिप्रेशन कैन ऑल्सो हैव दीज सिम्टम्स. सो जिस तरह से ये केमिकल्स क्यों कम हो जाती हैं, तो कई कारण हैं. दे कैन बी जेनेटिक रीजन्स ऑफ द केमिकल्स टू रिड्यूस. समटाइम्स आपको वो जेनेटिक्स मिलते हैं इनहर्टेड, समटाइम्स वो जीन स्किप करके आपको आ सकते हैं. कभी कभी हमको एक नया जीन मिलता है हमारी बॉडी में जिसमें डिप्रेशन के सिम्टम्स बहुत प्रीडिस्पोजिंग होते हैं. साथ ही साथ देर आर बायोलॉजिकल काजेज. Sometimes there are certain changes that happens at the circuit of the brain. Sometimes there are stress related. लाइक जो इन्वायरमेंट में हम रहते हैं, जिस तरह का हमारा घर का इन्वायरमेंट है, वर्क इन्वायरमेंट है, हमारी लाइफ स्टाइल है, हमारे फ्रॉम द टाइम यू बॉर्न टू वेयर वी आर राइट नाउ, काफ़ी तरह के स्ट्रेस हम पे वर्क करते हैं. तो ये स्ट्रेस हमारे ब्रेन से हमेशा कुछ ना कुछ चाहते हैं. उनको फाइट करने के लिए, उनके साथ विथस्टैंड करने के लिए, वो स्ट्रेस लेवल को कंपनसेट करने के लिए ब्रेन हमेशा काम करता रहता है. तो ये काम किसके थ्रू करता है? ये जो केमिकल्स हमने अभी बोले उनके थ्रू काम करता है. सो दीज केमिकल्स, समटाइम इफ द स्ट्रेस लेवल इज हाई और द ब्रेन इज नॉट एबल टू function and create that kind of chemicals which are required, it can produce the symptoms. So किस तरह से ये जब अभाव, ये जो deficiency है, the stress level is here and brain is only able to produce this much amount of chemical, or the requirement of the chemical is this, and the brain is producing still this much amount of chemical. तो ये जो deficiency है, ये किस तरह से दिखाई देगी? A very very simple example. आप रोज़ एक चपाती खाते हैं, ओके, एंड आप भागते हैं 5 किलोमीटर. रोज़ एक चपाती खा के आपको इतनी एनर्जी मिलती है कि आप 5 किलोमीटर भाग जाते हैं. आज अचानक से आपने एक ही चपाती खाया, लाइक रेगुलर रूटीन जो आपकी आदत है, पर अभी आपको रोज़ 20 किलोमीटर भागना है. तो क्या होगा? पहले 2-3 दिन आप कंपनसेट करेंगे, बॉडी कंपनसेट करके भाग लेगी 20 किलोमीटर, कुछ नहीं होगा. लेकिन कभी कभी देन स्लोली स्टेडली क्या होने लगेगा, 1 वीक 2 वीक के बाद आपको वीकनेस लगेगी, आपको थकान महसूस होगी, आपको बॉडी में पेन होने लगेगा, आप नहीं भाग पाएंगे, आपको ब्रेथलेसनेस होने लगेगा, पसीना आएगा बहुत ज़्यादा, घबराहट होगी बहुत ज़्यादा. सो दीज आर द वेज दैट हाउ अ बॉडी शोज द सिम्टम्स. तो सिमिलरली होता है विद द माइंड. जो रूल बॉडी पे लगता है, द सेम रूल्स वर्क विद माइंड. So when the body is not able to produce those chemicals, it start producing the symptoms of किस तरह के, what kind of the symptoms a person of depression will show. You will feel sad, you will feel low, Everything is there, everybody is there. The family is nice, your finances, you have a good job, you're a good family, you have the best husband possible, you have the best parents possible, you have the best kids possible. But then still you feel low. You feel sad all the time throughout the day. It never gets better, no matter what you try. You're trying to exercise, you're trying to listen to motivational speakers, you're trying to meditate, but nothing really works. You don't feel like walking at all. You don't enjoy what you used to always enjoy. You don't enjoy shopping, you don't enjoy going out, you don't enjoy lunch, you don't enjoy dinner dates with your husband, you don't enjoy anything. You don't enjoy your work anymore. Everything seems to look like a task. Everything seems like an effort that's required, get up from the chair, do your normal chores. साथ ही साथ there are symptoms, physical symptoms like weakness, headache, body ache, muscle pain, neck rigidity. Sometimes also, feeling of restlessness, anxiety. Sometimes there are feelings of, you know, you don't feel like living anymore. You don't feel that you're worth it. You don't feel that whatever you've done in your life is has any value in. Sometimes you feel, no matter what I try, I can't really get out of it. You feel there's no one who can help you. You feel helpless. There are a lot of irritation, sensitive mood. You feel like crying all the time. Anything can trigger. Can trigger your crying moods. And you don't know why you're crying and how to stop it. There are times when you feel that there is no point of living this life. You don't wish to, but there's still, intense thoughts of harming yourself, finishing your life. These are these common symptoms of how a person feels when they're going through depression. So these symptoms are the red flag signs. These are the warning signs which the mind is showing that you need help. Don't ignore what your mind is telling you. Don't ignore what your brain is telling you. Pay attention to those symptoms. Pay attention to what your relatives are telling, what your friends are telling. They're sharing their stories, they're sharing their feelings. It means your mind, your body, you need help. And who can really help you? A therapist, a trained therapist, and a trained psychiatrist can really help you to come out of these symptoms. So, what kind of treatment modalities do we have? We have very effective, very good walking medications, antidepressants, anti-anxiety that works wonders with patients. There are different kind of therapies like CBT, cognitive behavior therapy, family therapy, individual therapy, which really helps in the patients with depression. The treatment modalities are very effective. If you start with the treatment, there is a proper course that you need to follow. And if you follow this course, very likely your mind, your body, your brain will recover. And once it recovers, it becomes, you feel the change, you get the change, the whole environment of the family, the way you feel, the quality of life that a person should deserve, that gets better. So depression is treatable. Just watch for the symptoms and take help whenever possible. Bye, guys.